Testing. Can everybody hear me? Great. Good afternoon, everyone. For those of you who I don't know, which aren't that many, I'm Susan Doig. I'm the president and CEO of Trilogy. Happy Mental Health Awareness Month. It's May. Excellent. Perfect time for this. At a time when mental and behavioral health care continues, the need really continues to rise, I am so thrilled to welcome you all to this beautiful, bright, brand new space on the Northwest Side. Trilogy provides high quality, person-centered care for those who need it the most. And the demand for our work is higher than ever before. We are proud to meet this moment with more therapy, more clinicians ready to serve, and more outreach here in this area. We're providing critical life-saving care to children and families regardless of their ability to pay. Say that again, regardless of their ability to pay. People need help right now, and Trilogy is expanding to meet that need. Trilogy is already providing a variety of services in this space, in addition to providing therapy for children and adults. Our outreach teams are also here. They go out into the community and help people access care where they are. So you can get services here in our four walls, but we come to you. So for people prescription, getting their cell phone to work, which doesn't sound like a behavioral health care service, it sometimes is because it can create a real barrier to care. So those are the things that we provide, very practical services for people so that they can live independently. We also have supported employment. To provide more life-saving care for children and families and more crisis services that respond to every. We are also hiring. Yes, we are. We are always hiring. But really, for the past 3 years, we have been working very intentionally on becoming or remaining an employer of choice and creating jobs where people can really stay and grow. As our chief HR officer says, she's here, she says this to us all the time. We take care of the people who take care of the people. So that's what we need to do, and that's really our philosophy. Now more than ever, it's important to ensure that critical life-saving care is accessible to people when and where they need it. Helping people who need services the most uplifts our entire community. Really does. I mean, I think that's something that probably many of you understand in this room, but I don't know that outside of this room that people get so well. Trilogy is making sure that our door is wide open. We have this very bright color scheme, so I want everyone to sort of think about this as, we're going to have this brightly lit sign that says Trilogy's Northwest Side is now open. The importance of this work is done most effectively when we partner. In order to grow and expand, particularly as a nonprofit, we have to partner with allies who share our values, and we have many of them with us today. So, Representative Lindsay LaPointe, thank you for joining us today. She's a tireless advocate for our work. Rep. LaPointe is a fellow social worker, as am I, so social workers get things done. That's what we do. But I think having that perspective really helps Replipoint to keep mental health issues in the front and center of public conversation, and she does it with such passion and authenticity. We have, unfortunately, Samantha Nugent, Alderwoman Nugent is not feeling well today, but her staff is here. And Alderwoman Nugent came to visit our Rogers Park site kind of early in her tenure to see what we were up to, see what we're doing in mental health. So we're here in her backyard, so she's going to catch up with us when she's feeling better. And then I really wanted to share Trilogy's deepest appreciation for the generous support of the Cook County team. This space and the potential that this new location represents was made possible in large part by a $1 million grant from Cook County Stronger Together. So it's a huge investment. So today we are joined by Cook County Board President Tony Preckwinkle and Jennifer Brothers, Executive Director of the Impact Fund and Community Services of Cook County Health. This expansion was also made possible by some new partners, Illinois Children's Healthcare Foundation and the Visiting Nurses Association Foundation. So thank you to all of our supporters that really helped put us on this path. And thanks to our team. Many of you are here today. They're giving tours later on, but we can't do the work that we do without the staff who, embrace this really difficult work. So thanks to our staff and our board members. We have several board members here today who support us in a really uncertain time and allow us to take some risks and keep doing what we're doing. So thanks to our Trilogy board. I have to mention too, we're opening a 24,000 square foot wellness center on the south side at 85th and State. Construction will be done on the first phase at the end of this month, at the end of Mental Health Awareness Month, so very appropriate. But we really want to be where the need is, and so that people aren't traveling from one end of the city to another to get the services that they need. And so, again, we are hiring. We really want to be, we really want to be an employer for communities. So, and we take very seriously people's employment experience. So after all of the remarks today, please walk around, eat a donut, talk to a staff member about the work that we do. We really want everyone to kind of stick around and get a sense of the space. And then I have one more very special introduction. Tricia. Tricia will be, Tricia's one of our clients, and she has offered to talk to all of you about the services that she receives at Trilogy and how they have helped impact her life. So thank you, Tricia, and the mic is all yours.
Hi, my name is Tricia. Good afternoon. Good afternoon. First of all, I would like to take a moment to say thank you to Trilogy for the honor of speaking with you today. I do feel that this is an honor to be representing the clients that receive your services. Quality, affordable, and accessible mental health services they must be available to everyone. Trilogy works hard to make that happen. My family and I are so grateful for the services we have received from Trilogy for over 6 years. From one-on-one adolescent therapy for my 2 sons who have learned many tools and skills that they will be able to use their whole lives. Our family therapy that's helped us learn how to communicate with one another, to speak with one another, to hear one another, which I think is probably the most important thing. And it continues to help us day to day. And to the one-on-one therapy for myself, Trilogy has been not only but life-saving. As someone who has severe PTSD and anxiety disorder, having Cara guide me and give me the tools I need to thrive, regardless of my diagnoses, I could never thank her enough. She and Trilogy have given me a safe space to be heard, to be challenged, and to even be held accountable. I used to feel broken and weak because of my PTSD. Cara has taught me that I am more like the Japanese art of kintsugi. That through therapy and my hard work, which she reminds me of, that it's not her, it's me, my broken pieces have been put back together and I have been made stronger. So I'd like to say thank you, Trilogy, for doing your part to support our community. And I hope you continue to receive the support needed to continue your much needed services. Thank you.
Thank you so much, Trisha. We're really grateful for you for sharing your story. Not everyone can do that, so thanks so much. And now I'm honored to introduce someone who has been a tireless advocate for Trilogy and for people in mental health recovery across the state of Illinois. In her district here in Chicago and in Springfield, State Representative Lindsay LaPointe champions the voices of the people that Trilogy serves. We are so grateful for Rep. LaPointe's ongoing partnership, her concern, her thoughtfulness, the way that she crafts legislation. She checks in. She's genuinely interested in knowing how government can work for us. So thanks, Rep. LaPointe, and we'd love to hear your thoughts.
Thank you, Susan. Congratulations to Trilogy. And thank you for those words from the perspective of somebody who was able to access the behavioral health treatment and support that you and your whole family needed and will continue to need across the lifespan, just like all of us. And I think one of the most important takeaways when we talk about behavioral health is this isn't some other group of people that needs access to behavioral health across the lifespan. It is us. And so the fact that I officially represent you in Springfield means so much to me. Powerful words. Thank you, Susan. To the frontline professional staff that are out there delivering behavioral health, you have my heart. You are doing hard work and you are doing underpaid work, and it has been endemically undervalued in our culture. And making sure that you get the compensation that you deserve will continue to be one of my top priorities in Springfield. And Susan, you've mentioned, so important. Susan mentioned that Trilogy is hiring about 3 times. And every time you mention that, I don't need to be reminded, but we have an acute behavioral health care workforce shortage. And I know the state has recognized that, the county has recognized that, and devoted targeted resources and strategic thought to how do we reverse this trend. But I don't want to forget that the most simple things that we can do when it comes to building up the workforce is just paying people more for the life-saving work that we're doing. So we have to continue to do that. Just going to zoom out a little bit. We are in such an important moment for behavioral health across this country. We're at a moment where the needs are higher than they have ever been. We are also at a moment where stigma is down, which is an incredible testament to all the work that people have been doing. And that means that people's willingness to seek support is actually higher than it's ever been. And that is a really, really good thing. But all too often, when people have that willingness to seek support, if they pick up the phone and they look in a provider directory, or they call their friend, or even they call their state rep, because they do that too. Or even one of my colleagues just this week in Springfield said, my nephew's really struggling. He just got out of Silver Oaks Hospital. What do I do, Lindsay? We need people on the other end of that phone in a timely fashion who are going to be warm and help direct people how to connect with treatment and support immediately. And that is why Trilogy opening up on the far northwest side of Chicago is so important to me. And I'm just so thrilled that we're here in this moment and that the county has invested in this too. Because the far northwest side of Chicago, although you might not know it unless you live here or you work here, historically it's actually a human service desert. And we don't talk about it that much because we have a lot of pride here on the far northwest side, but we also have a lot of needs. And if you have no idea how to navigate the behavioral health or human service system, and you're living in a human service desert, you are not going to get connected to the care that you need. And so the fact that we are here now, even if it's not on a main street with a beautiful sign where everyone can see it, you are here and we're going to talk about it a lot. And the parking was pretty easy, which on the far northwest side, people up here care about parking and free. So I, in partnership with others in this room, we're going to do our part to uplift that you are here, because we know that people have needs. People have real urgent needs. And the fact that you are here on the far northwest side, you're making it easier so people don't have to navigate things that are scary and intimidating. Calling your state rep, talking to your friend, provider directories. The fact that you are here and present in the community is just going to make it easier for folks. One other thing I want to add to kind of just give you a little bit of a view into Springfield and how we care so much about affordable and accessible behavioral health care, and we're doing that nitty-gritty policy work to get us there, as is the county. Susan, you said regardless of the ability to pay. And that is also incredibly important. And that's what Trilogy is here for. But also, I want to remind everybody that at least up to this point, Illinois has done a pretty good job with helping people connect with some type of insurance. 93% of everyone in Illinois right now, at least, have some sort of insurance plan. That might be Medicaid, it might be Medicare, it might be healthcare benefits for immigrant adults, it might be commercial insurance, Blue Cross Blue Shield, Aetna. And because mental health care is health care, people should be able to use their insurance to seamlessly access timely behavioral health support, period. And when we don't think through those lenses, we let insurance companies off the hook. And when it comes to Medicaid, we have a fair amount of power in Springfield. We are in charge of Medicaid rates. And so if we can keep kicking up those Medicaid rates and keep reducing the administrative burden and the red tape, that will help everyone in this room, and it will help Trilogy thrive. And this is something, in terms of overall access to behavioral health, we actually have a fair amount of consensus among both parties that we need to do this. We need to get more affordable and accessible behavioral health care. We don't have agreement on exactly how we get there. So we're going to keep fighting that fight. And I'd be remiss if I did not mention that Medicaid is the biggest funder of behavioral health in Illinois. So we're going to celebrate today because this is a very joyful day in Mental Health Awareness Month. But if we keep fighting for mental health, we also just have to remember, and I know many of you fight this fight every day, that because Medicaid is the biggest funder of behavioral health in Illinois, and because Medicaid is supremely at risk right now due to what's happening in Washington, we have to keep fighting for that, and we have to connect the dots for people. If you want access to behavioral health care, we've got to have a Medicaid system that works for people. So thank you so much for being here. I'm so indebted to the county for making behavioral health a priority. Jennifer, always great to see you. Thank you for your work. Madam President, thank you for being here on the Northwest side. I'll hand it back over to Susan so we can get going and hear your words.
Thank you, Representative LaPointe. Really grateful for your inspiring comments and, and all the work that you're doing. We see a lot of you, hear a lot about the good work that you're doing, so thank you. The team at Cook County Health have been instrumental in helping Trilogy operationalize our mission and really turn into action for people who need services today, especially for youth. We thank the Cook County and Cook County Office of Behavioral Health for their tremendous support. This wouldn't be possible without a lot of vision and leadership. This is a big task, these grants. And I think there was a lot of thought put into how do we make the most impact. And just a little story. Recently, funding has become more tenuous for organizations like ours. And a few weeks ago, we got an email letting us know that some of our funding would be cut, a significant amount of funding. And we've been bracing ourselves for these emails for a long time. And I heard this and immediately emailed Jennifer and said, we've heard about this cut. Is this also going to impact the Stronger Together grant? And she quickly and confidently emailed me back and said, no, Susan, we thought of that. We had enough foresight to know how to ensure that funds are protected. And so I think that is really an example of good government working for the people. So thank you for being so smart. And with that, we really need to welcome President Preckwinkle. So thrilled that she is here. She's done so much for us for so many years. So thank you, President Preckwinkle.
Good afternoon, everybody. So I'm very grateful. This is a little awkward. You're all over here and the camera's here. So anyway, I'm grateful to be here today at Trilogy as we celebrate the expansion of mental health resources for the Northwest Side of Chicago. I want to acknowledge not only State Representative LaPointe, but there is Nancy Negrete is here, who is a representative from Commissioner Almanaya's staff, and Sam and Catherine are here from Alderman Nugent's staff. Is that right? Of course, President and CEO Doig, Jennifer Brothers, who's the Executive Director of the Impact Fund for Cook County Health's Office of Behavioral Health, and she's here representing our CEO, Dr. Eric Makaitis. So thank you all for joining us. And I want to thank the entire Trilogy team for their dedication to our residents and their continued commitment to expanding access to care in our communities. I want to thank Tricia for your story, your testimony. It reminds us why this work matters. Looking back to last June, we gathered at Cook County Health to announce our Stronger Together grants. As you heard, Trilogy got $1 million. We awarded funding to 53 organizations focused on supporting the mental health of our Cook County residents, and Trilogy is one of those recipients. The goal behind these grants was simple but powerful: to increase health touch points across Cook County and bring services closer to the people who need them most. And as you heard from your CEO, or I guess it was Lindsay, representative, this is an area of the city and the county where we're kind of under-resourced in terms of social services. So many of you know that there's a mental health crisis facing our country, and meeting that crisis requires collaboration, commitment, and action at every level. Okay, so we've got some real challenges ahead of us here. Representative LaPointe talked about Medicaid. The governor's budget as submitted no longer includes support for health benefits for immigrant adults. For Cook County Health alone, that's a $111 million hit, not just this year, but every year thereafter. It also means that there'll be a substantial increase, we believe, in the people who need charity care. So on one hand, we've been deprived of resources. On the other hand, our costs are going to go up because we provide care to whoever comes to our door. So this is a real challenging moment, not just at our state level, but of course at the federal level, because the budget that the Republicans in Congress, the cap that they put on the budget, can't be reached unless they make significant cuts in Medicaid. Now, whether they're going to renege on their commitment to that cap, or whether they're going to, as they say they're not going to, make substantial cuts in Medicaid remains to be seen. But we're looking, not just here in Cook County, but across the state, across the country. We're looking at a moment in which the federal government is withdrawing support from local communities in a variety of ways. And they talk about it as cost savings, but really what it is cost shifting. It's cost shifting down to our local communities. Because either people don't get services or we struggle to provide them at the local level. Let's be clear about what's happening here. When everybody talks about cost savings at the federal or the state level, I know what they're coming for us. Because the money has to be found somewhere, or people don't get any service. This is a difficult moment. So that's why health equity remains so important to our work, remains central to our work. It means that every person, no matter their income, zip code, or insurance, should have access to care. And for 180 years, we've provided anybody with care who comes to our door in the Cook County system. But I'm not sure that we can continue to do that if we lose our state and federal resources. Potentially, it's about $1 billion hit to Cook County Health. $1 billion out of a $5 billion budget. That's a pretty big hit. And yet we know that 1 in 5 adults in the United States lives with a mental illness. And for many, access to care is difficult because of barriers beyond their control. So I want to celebrate today, but I want you to understand that this is an inflection point. And it's important for all of us to communicate to our elected officials at whatever level how important health care, physical health care, and behavioral health care are to you and the communities that you represent. Mental health is health, and every person's needs are different. That means we need a wide range of services. Trilogy offers essential services to our communities, and that makes real lasting change in people's lives. So thank you. I'm grateful to be here, and I don't want you to leave here discouraged. So here's what I say. Martin Luther King said a number of prophetic things, but one of the things he said was, the arc of the moral universe is long, but it bends toward justice, right? The arc of the moral universe is long, but it bends toward justice. But I always say it doesn't bend of its own volition, right? Good people at every moment in our history have to step up to try to bend the arc, and this is our moment. So thank you.
Good afternoon. I'm not sure how to follow that. I just have to say I'm honored to be here today on behalf of Cook County Health Office of Behavioral Health. My name is Jennifer Brothers, and I'm the Executive Director of the Impact Fund and Community Services for the Office of Behavioral Health. First, I'd like to thank President Preckwinkle, the Cook County Health Board of Directors, the Cook County Commissioners for their continued support for our work, especially the Stronger Together initiative. I'd like to thank Representative Lindsay LaPointe for your tireless advocacy and work. I also want to recognize the incredible support of Dr. Eric Makaitis, CEO of Cook County Health, and Dr. Tom Nutter, our Chief Behavioral Health Officer. And of course, I want to thank my extraordinary team who's here with me today. It's because of your dedication and commitment that we're able to do this important work. Standing here today to celebrate Trilogy's new location, especially with the Chicago Youth Mental Health Wellness Project as a pillar of this location, is both exciting and meaningful, not only as a public health professional, but as a parent. Professionally, we know that the data is clear. Providing individual, family, and group therapy early in a young person's life can make a transformative difference. Proactive care, especially for children, youth, and families, helps prevent behavioral health challenges from worsening, reduces long-term complications, and builds stronger foundation for lifelong well-being. Personally, as a parent, I know there are few things harder than watching your child struggle and feeling powerless to get them the help they need. Every child and every family deserves timely, accessible, and effective mental health support regardless of their ability to pay and regardless of where they live. As President Preckwinkle shared, when we created the Stronger Together initiative, our goal was to build a more equitable behavioral health system, one that expands access to care across Chicago and Cook County, particularly in historically underserved and disinvested communities, and especially for children, youth, and families. In this work, we often say there should be no wrong door when it comes to getting care. What works for one family may look different than another. And that's why we prioritized uplifting organizations that are deeply connected to their communities and have a proven track record of delivering meaningful, compassionate care and support. As the Cook County Health Office of Behavioral Health, we are proud to stand beside Trilogy. We couldn't be more grateful for your partnership and other community-based providers who are driving change where it matters most. And we look forward to hearing the hope, the healing, and the transformation that takes place between these walls and beyond. So thank you.
Thank you, Jennifer. Yes, and yeah, as a parent, yes, mental health services matter a lot for children. I've experienced that myself. So we're ready to ribbon cut. Yeah. Trisha gets to do the honors. Oh. Hi, Representative Mike Kelly is also here. Thank you. He snuck in. Thanks for coming. You get to see it. So, all right, we're ribbon cutting. You're going to be in the middle because. Did you get a nice long pair of scissors? Okay.
Got a little tiny baby sister.
Great.
Can we get the photographers in one place before you guys don't cut it, let everybody get their photos?
Yes, ma'am.
Okay.
So if we can squeeze in just a touch,
Okay.
if we can move over like a foot this way.
Foot this way.
Cut my dress.
Yeah, thanks.
Ready?
Okay, we're ready.
Yay!
Trilogy. Thank you.
Thank you.
Thanks, President Preckwinkle.